class, my name is Stacy Hemd, and today I'll be discussing an article entitled The Role of Provider-Patient Communication and Trust in Online Sources and Internet Use for Health-Related Activities. This is an article by Ho and Shim from the Journal of Health Communication. As we've discussed in class, the role of the provider-patient relationship is quite important to build trust in the provider and healthcare relationship, as well as provide good outcomes for the patient. This article looks at the role of the patient-centered communication. Based on previous research on provider-patient communication and online health activities, we may expect that if one's provider-patient communication is perceived to be less open and patient-centered, this patient may experience difficulties meeting their support needs and addressing illness uncertainty during a medical encounter. This failure to meet the patient's needs will increase the motivation to use the internet as an alternative communication channel for health-related purposes. This leads us to one hypothesis from this article. The lower the perceived patient-centeredness of provider-patient communication, the more likely individuals are to use the internet for health-related activities. In health-related contexts, if individuals fail to have their needs fulfilled through their provider-patient communication and feels that their questions, uncertainties of their illness, emotional stress, or feelings cannot adequately be understood and addressed by the provider, then they would be more likely to seek out an alternative communication channel. I see some of my friends that ask for healthcare advice on Facebook, even though it may not be the most reliable source on the internet, but I believe it fills for them a void that they are not getting from their providers. Patient-provider communication serves several purposes, including the exchange of information, the development of good interpersonal relationships, and shared decision-making. These purposes are closely connected to the notion of patient-centeredness. This study analyzed data from the National Cancer Institute's Health Information Trends Survey conducted in 2007. This study included a subset of sample online users who visited healthcare providers at least once in the past 12 months. Perceived patient-centeredness of provider-patient communication was measured using 6 items that they asked respondents how often during the past 12 months doctors, nurses, or other healthcare professionals, 1, gave them a chance to ask the health-related questions they had, 2, gave them the attention they needed to their feelings and emotions, 3, involved them in decisions about their healthcare as much as they wanted, 4, made sure they understood the things they needed to do to take care of their health, 5, helped them deal with the feelings of uncertainty about their health or healthcare, and number 6, how often respondents felt they could rely on providers to take care of their health. The responses were scored on a 4-point scale and then averaged. The first hypothesis posed that the lower the perceived patient-centeredness during the medical communication, the more likely the individuals are to use the internet for health-related activities. The results showed that the perceived patient-centeredness of provider-patient communication had a significant association with 3 of the 4 online activities that were assessed. Specifically, as individuals perceived their communication with healthcare providers to be less open and patient-centered, they were more likely to use websites to seek health information. There were some limitations in this study. One thing to note is the sample of the study had a mean average of 50 years of age, was overall well-educated, white American, and with relatively high annual income. This study suggests that those who reported lower levels of good patient-provider communication on average had reported a higher level of online health activities. The findings from this study have important implications for the provider-patient communication, as they help healthcare providers to understand patients' behaviors in terms of addressing information and emotional needs. On one hand, healthcare providers need to be aware of and pay attention to patients' needs and frequently ask patients' feelings and perceived quality of communication so as to build a patient-centered environment. On the other hand, since the internet is an increasingly important source for getting additional health information, it is necessary for the providers to direct patients in getting useful online information that's related to their treatment, lifestyles, and emotional needs, and also to discuss with the patients the health information they've obtained from the internet. In conclusion, having strong communication skills to talk with patients and build a patient-centered communication are both critical and challenging for today's healthcare providers. So now I pose to you these questions. Do you think there is a link between patients' perception of patient-centered communication and the use of internet-related health activities? 2, if there is low patient satisfaction in the patient-provider relationship, can it be improved by better communication skills at a future point in the relationship? If so, how can a provider improve their communication skills? Number 3, how are we as healthcare providers responsible if we fail to establish a satisfactory patient-provider relationship or patient-centered communication? And number 4, how does patient-centered communication establish satisfactory provider-patient relationships? Thank you for listening to my critique of this article.